Hi, good morning. Thanks for visiting my channel. This is going to be a right horizontal cupulolithiasis video. So I would encourage you, if you have not listened to the other videos on vertigo, that some of the information I might have said in those videos might not be replicated here because I go off the cuff. I don't use a script or anything. I just go by memory. So it's specifically for people who've worked with me, who have a diagnosis of this, not necessarily people who might self-diagnose. I wouldn't recommend that. I would recommend using the information here to bring it to your provider, your doctor, your nurse practitioner, or so forth. And if you feel like you have vertigo, request a referral for a therapist specializing in BPPV. So it's benign positional paroxysmal vertigo. And then they can do assessments. You'd want to ask for someone who works with all 6 canals. We have 3 on each side. And from there, there's 12 different treatments. So it makes it a really hard system to understand unless you've been trained in it. And so just seek out the right person and make sure that they assess you for all 6, not just 2 or 4, because if they choose the ones they're familiar with and you're fine with those and you go away thinking, well, that didn't help, why should I bother with anyone else? This is common for what I hear. Then you might feel sad or down or frustrated or all of the above with the medical system. So just know we're all trained a little differently. We all choose what we would assess or evaluate differently depending on our skill sets as therapists. And so let's go from there. The basic information is to use what's called the modified CAT-SIB balance test to understand where your balance is going in order to know when to treat the canal. So this is specifically for people who are standing with their feet together safely in the corner of a room, and then with the eyes closed, lean off to the right, and you cannot seem to get back to center. Now, it's not for people who say, well, I'm trying to avoid falling left, so I'm throwing myself to the right. This is specifically, I have my eyes closed, I just keep going off to the right. I can't be back in the middle and stay there. So from there, what you'd need is have a vibration tool. There's a mini vibrator that we use in therapy. And, the head size is about that big. It's not very big. And the place you'd vibrate when I give you the information to do so is on the back right part of your ear on the mastoid bone. So you kind of set your bed up or your couch. Some people do it on the floor with with 2 pillows on one side. So kind of get your tools ready. I will time this for you so you don't have to worry about making a timer as well. It's a 16-minute treatment in total. And some people have asked me, how do I just I don't want to do that balance test. I just want to do the treatments. So if you feel like it's too hard for yourself to do 2 minutes every morning of your balance to see where you're leaning, if it's moderate or mild or like you lose your balance altogether, if you want to just do this every day, that's great. Go ahead. So you're going to lie on your back, and then you're going to rotate on your right. Giving you a little time here. And so you're going to start with your head rotated down at the floor. So when you're ready, we're trying to use that vibration tool to get the crystals to start moving because they're stuck in the canal and go back to their house. So this particular canal, the horizontal one, is the longest one. So it takes more time to go all the way around to get back in the house. These are otoconia. They're made of calcium carbonate. They can come out frequently. When it's chronic, it's not a one and done. It's a management thing. I know, oh, I have to do this every day. Some people tell me. And then I say, well, how old are you? Okay, 80 years old, 40 years old. Why not spend 20 minutes a day on yourself? While you're there listening, I've noticed, which is really nice, that when this is treated, people have reduced spasticity after a stroke in that side. Pretty phenomenal. Not just improved balance, not just reduced dizziness, but also kind of a mind clearing, easier to think. Because if these are out and you have vertigo that's chronic, your whole time you've had it, your mind is constantly trying to figure out where are you in space regarding gravity. So you're always having to figure this out, even if you don't know it. And that's exhausting. And that can be anxiety provoking and depressing and frustrating, even if you don't know where it's coming from. So vertigo isn't just, I wake up and have the spins and then I have to go to ER and then they give me medicine to suppress the vestibular system. It's the vestibular system we're working on here. That's just kind of a Band-Aid. It's this treatment that's consistent that will help you reduce symptoms and improve your life. So you're on your side, you're looking at the floor on your right. Set timer 2 minutes. What I'd like you to do is take that vibration tool right behind the right mastoid while you're looking at the floor. I know it's hard to get there. We're vibrating 1 minute in this position, but 2 minutes total. The key for this is do not extend your neck. Keep your chin down. If you do move your neck during the position changes, what happens is those crystals move and they can move into another canal. And then you might end up dizzier when you're done and have to do a different treatment. The canal that normally they move to is the posterior one. I have videos for the posterior canals too, but let's not try to go there. So keep the chin down. There's a minute of vibration, so you can take your vibration tool away, but don't move your head. When this buzzer times, what you're going to do is let your chin stay where it is, but let your head rotate so your head is even horizontally with your body, and you're going to look out at the wall. But don't do it yet. I just tell people in advance so they know what to do. Obviously, I assumed you knew, put your head on the pillows, the 2 pillows that are there. So go ahead and just bring your head to neutral with the spine so you're on your right, just looking at the wall straight out. We're going to 2 more minutes. Each position is 2 minutes. We're going to rotate around like a barbecue spit and end up back on the right side. So while you're here, feel for any changes in your body. Some people report wooziness, dizziness, lightheadedness. nausea, pain. Pain's a big one when these canals are out. Why pain, people ask? Well, if these vestibular systems on each side of the head have a chronic challenge, then you're compressing more. They're kind of falling into themselves to give yourself feedback on that side. So you can actually elongate your spine by treating these. Like I said earlier, people who have a flexor spasticity, meaning if you've seen someone who has a stroke or a head injury with their arm flexed up and tucked against their body with a fist, it can actually reduce that because the system can open and not have to pull in to have feedback. The whole purpose of the system is, where am I in space? Where am I in relation to gravity? Just pay attention if any pain on the right side of your body reduces after this. The balance test beforehand can tell you also it worked because I have better balance and I don't fall to my right. So keep your chin tucked and rotate from your right onto your back on the pillows. I'll give a little more time because some people I work with are like 90 years old and it takes them a little more time to get here. So just know a little more time is okay. It's going to work better than shortening it and trying to hurry it. You can't hurry this. So you're on your back. You can keep your eyes open, no problem. You're just noticing any sensations. Nausea might come up. Tingling might come up. Ideally, you want to keep a little notebook of the symptoms you have during the treatment so you know when those symptoms come back, that canal needs to be addressed with this maneuver. Everybody's a little different. So just more information while you're here. So another thing to think about is when astronauts go to space, they don't have gravity for their spinal cord, their bones, their muscles to kind of know where they are. So they have to be careful when they come back from space that their whole body isn't soft. That's why they have to exercise up there. So we know gravity is really important for our elongation of our spine and not curving one way or another, which causes injuries, musculoskeletal injuries or pain, or even in organs, liver, spleen, gallbladder, pelvic floor, lungs, heart, everything. It doesn't like to be squished. That's why most people can't find it, because it's so different for everybody. So you're going to keep your chin down and now rotate on your left side with your head elongation with the spine not turned. Get your vibration tool and go behind the right mastoid for 1 minute with the vibration on. You're looking out, not down, out. Your spine's elongated together, but your chin's tucked. Some people might hear the tink, 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 kind of like a silver metal clinking. Those are actually the crystals moving. Go ahead and remove the vibration tool, but stay in this position. Prepare your mind for Okay, now I'm going to have to, after the timer goes off, you're going to have to rotate from your left, keep going left onto your stomach. Don't flip back onto your back. Keep going in the same direction. And you can rotate on your tummy, but chin has to stay down. A lot of people will extend their neck to get over on their stomach, and then they have the canal problem in another place. So chin stays down. Rotate once the timer goes off, onto your stomach or hands and knees or elbows, but the head has to be down. So prepare for the rotation. And when you get there, I'm going to start the timer. I'm giving you a sec. I use this with many patients. Stroke patient, head injury patient, just person who doesn't have any neurological reasons. But most of them say, I did have a head injury in the past. I forgot about that. Fall when you were 5 years old and hit your head or something. So you're on your tummy. Your chin's down. Or your hands and knees, chin's down. Forearms, plank, chin's down. Just notice any changes in your body. Any symptoms, feelings can even change from I was uncomfortable, had anxiety, to now I'm relaxed. I feel like I want to sleep. Those are changes that work. When we want to sleep after this, it means your central nervous system's happier. And they don't stay in there permanently from now on. You have to work on this for the rest of your life. Oh, really? People say. I say, just use that. And then sometimes it's fixed, but most often it's not. Cold air outside, going to the dentist, having a stressful event, having the flu, going to get your hair done, any of this can knock them back out. Once they're out, they don't like to go back and stay there. You want to put them in their house every day. We're almost to the last position. Your chin's going to tuck. As you move from your prone position, meaning face down, chin tuck, rotate back onto the right side. Facing out, not down. So you're on your right where you started, fully on the right side. Head is out, looking at the wall ahead, not at the floor. 2 more minutes here. My cat might have his tail show. He likes being at the computer. Yeah, there it is. So you're on your right. You're just paying attention to any shifts or changes. Sometimes after this last 2 minutes, people will sit up at the edge of the bed. Basically, do not turn to the left. Just sit up from where you are. Not yet. When the timer goes off, I'm preparing you for what to do. So when you're on your right, don't rotate. You can sit up from that side and then sit there for about a minute. Sometimes you might feel a little more dizzy because the crystals are moving now and your eyes might feel fuzzy, and This system works with the vision as far as where I am in space, if you're a sighted person, but even people who are blind have this problem because these systems work very closely together, the vestibular and the eyes. I haven't done a video on that yet, but I'm going to get to it, and it's called a vestibular ocular reflex. So like there's steps to this. It's not just a one and done. I repeat myself a lot because it's hard to remember what I'm saying while you're doing this because it's changing everything for you. So go ahead and sit at the edge of your bed or couch or sit up from the floor. We're going to do a minute here where you're just letting things settle. Don't flip your head up. Keep your head neutral. Don't look down or left and right too much. Just try to sit straight ahead. You want these to kind of fall back into their house, these crystals. They're called otoconia. And preferably after the minute timer, I'll tell you when it's time. It'd be good to stand again in the corner of the room and see if you can stand with your feet together, eyes open first. See if you sway. Swaying is normal, left and right. You can go in a circle. You can go in the other circle. It's telling you your navigation system, your vestibular system is recalibrating so you know where you are in space. Now, then close your eyes. Each position for balance is 30 seconds. Close your eyes and see if you don't fall off to your right anymore. If you sway there and come back to the center, then you know you've done it. If this is the first time you've done it, most likely not if you've seen me as a client. But if it's the first time you do it, it can take a day or two for the nervous system to settle down. Just depends on how long it's been there. So go ahead and stand. We did a little longer than a minute. And just feel how you're feeling. Make some notes today for what symptoms came up the most. And you can redo this daily if you want. That's fine. Wouldn't hurt you. And then see over time if you can move it to every other day, every few days. So thanks for coming. If you feel like this helped you out, feel free to share it with somebody with the intention, if they haven't gotten the diagnosis yet, they can use the information to talk to their provider or talk to their therapist if they're seeing one and say, hey, what about this? What about that? You can subscribe. That will help you if I do more videos, which I will be doing. Depends on which one of these you found or multiples that you need. And then you'll get that notification. And if you like it, hit that thumbs up. Helps me have access to other people because many people need this. They just didn't know because all the tests they've gone and participated in haven't shown it. MRIs won't, CT scans won't, X-rays won't, medications won't. It's a very particular system. And yeah, let's just all feel better. That's the purpose of me doing this on my days off. So anyway, thanks for coming to my channel and visiting your friend Christine, and be well. See you next time.